HIV virus, created by Michael Martinez, Jared Sutton, and Matt Quintero. The disease we'll be discussing today is HIV virus. The cause of HIV is a human immunodeficiency virus. It is spread via sexual intercourse, contaminated needles, and blood transfusions, or from the exchange of bodily fluids. HIV is a virus and is fairly important because HIV is an incurable disease and kills roughly 5,500 people every day. Around 42 million people are estimated to have the HIV virus.
In 1981, the media reported an outbreak of a rare form of cancer among homosexual men in New York and California. This rare form of cancer became known as caposinarium. During the same time, there was an increased number of healthy men being treated for pneumocystis. After months of research, the Center for Disease Control linked the illness of blood, which became known as acquired immune deficiency syndrome, or AIDS.
In 1984, scientists at the Institut Pasteur of France discovered that the HIV virus was the cause of AIDS. Following the discovery, a test was created to test for HIV. Scientists dedicated the years that followed to creating a medication to combat the virus. Today, there are a number of different treatments that patients take in order to combat the deadly virus. In 2008, it is estimated that there are 33.4 million people worldwide that are living with HIV, and nearly 3 million people that are newly infected each year. Since the first discovery of the deadly virus, more than 25 million people have died of AIDS. It took 8 years from 1981 to 1989 for the first 100 cases of AIDS to be recorded to local health departments.
AIDS cases were shown to be at a rapid incline during the years from 1981 till today. In 1993, AIDS cases were at their peak. In October 1995, the 500,000 total was confirmed. In 2001, statistics showed that of the 816,149 people that were classified with AIDS, 666,026 were male. That's 81.6%. Of those 666,026 people, just 17 were women and only 1% were children under the age of 13. After 1995, people were scared of the AIDS disease, and multi-drug therapy was administered to those who were infected with the disease. AIDS has become the leading cause of death for people from the ages of 25 to 44.
The very first symptoms of HIV infection can be very similar to flu or cold-like symptoms. They can also resemble the first symptoms of some sexually transmitted diseases or other types of infections, like hepatitis or mono. The most common types of symptoms are fever, fatigue, or can develop some sort of rash. Some other symptoms include swollen lymph glands, sore throat, nausea, diarrhea, or night sweats. If someone were to contract HIV, they could either have very strong symptoms or no symptoms.
There's no cure for HIV at this time, but there are a number of different things that one could do to treat HIV. HIV can be treated by using 11 different approval antiviral drugs that are used in combinations of 2, 3, or 4 to slow or stop the HIV virus. There are two main types of antiviral drugs, which are protease inhibitors and reverse transcriptase inhibitors. There are also preventive medications used if an individual's CD4 count falls below 200 to prevent PCP, MAC. If the CD4 count falls below 50, this MAC is required. If HIV is left untreated, the long-term effects would be that it will eventually turn into full-blown AIDS, which is the last stage of the infection. If left untreated and the HIV turns to AIDS, it would increase the likelihood to develop certain opportunistic infections like tuberculosis and some cancers because of the weakened immune system. Some short-term effects of HIV are that you may not have any symptoms but would need to continue to check up on the viral load and CD4 count before it is prescribed further.
As you can see, HIV is a very deadly and lethal disease. There are a number of different precautions that we can take in order to avoid contracting it. To prevent HIV infection, you can avoid contact with infected blood, semen, or vaginal fluids. You could also reduce the number of sex partners, practice safe sex, and don't share your heroin needle with other people. Mothers who are infected with HIV could also reduce the risk of their baby becoming infected by taking medication that reduces the viral load to smaller levels during pregnancy. There are also preventive medicines for individuals who feel that they may have been infected within the last 72 hours.